Hey guys, welcome to this my new video on functions of WBC and variation in the WBC count. So functions of neutrophil. The neutrophil along with the monocyte constitute the first line of the defense against the microorganism, viruses and other injurious agents that enter the body. Now neutrophil that plays this role by specific mechanism, and that is phagocytosis. So what is phagocytosis? Phagocytosis means eating and pinocytosis means drinking. So neutrophil that engulf the foreign particles or bacteria and digest them and ultimately may kill them by process that is known as phagocytosis. Then reaction of inflammation. So the neutrophil also release leukotrienes, prostaglandins, thromboxans, etc. and that bring about the reaction of inflammation like vasodilation and edema. Then third function is febrile response. The neutrophil contain a fever producing substance called the endogenous pyrogen and which is an important mediator of febrile response to the bacterial pyrogens. Then we will learn in detail about the process of phagocytosis. So phagocytosis means eating of cells, refers to the process of engulfment and destruction of the solid particulate matter by the cell. The cells performing this function are known as phagocytes, and in addition to neutrophil, the monocytes also the fixed tissue macrophage also play this role. The process of the phagocytosis that involves a certain steps like margination, immigration and diapedesis, chemotaxis, opsonization, engulfment stage and degranulation stage, killing or degradation stage. So these are the images of stages of phagocytosis. This A is margination, B is diapedesis, C is chemotaxis, then D that is a opsonization, then E that is a engulfment, and F formation of the phagolysosome, and G that is a degranulation. So first of all about the margination. So the normal axial blood flow that consists of central stream of the cells like leukocytes and RBC and the peripheral cell free layer of the plasma that are close to the vessel wall, and in the area of the infection the neutrophils get marginated, means get attached toward the capillary endothelium and start rolling along its surface. This process is known as margination. Now the margination that is caused by binding of the selectin. Selectin that is a cell adhesion molecules that are present on the endothelial cells with the carbohydrate molecules present on the surface of neutrophils. The endothelial selectins are increased in the area where there is a inflammation.
Vascular changes.
Now this
Vasodilation,
video
mediated by
shows
histamine
the
and
process
nitric
of
oxide,
phagocytosis.
starts in the arterioles and moves into the capillary beds close to the site of injury. This is responsible for the heat and redness seen in inflammation. Vasodilation causes the flow of blood to slow down and allows large white blood cells, or leukocytes, to move towards the walls of the vessel in a process called margination. Chemical signals released from the site of injury cause changes to the endothelial wall of the vessel. The endothelial cells contract, allowing fluid into the surrounding tissues through the gaps in the cells, and resulting in one of the clinical signs of inflammation, swelling, or edema. The endothelial cells are also stimulated to start expressing selectin and ICAM proteins on their surface. Selectins bind to glycoproteins on the surface of cells, and ICAM proteins bind to integrin, protein expressed on the surface of leukocytes. These allow the leukocytes to bind to the walls of the vessel. This binding is weak, and the connections between the leukocytes and vessel walls frequently break and reform. This results in leukocytes slowly rolling along the vessel walls. Chemokines will bind with the leukocyte to activate it, which induces a change in the structure of integrin. This change makes it bind ICAM tightly. The leukocyte stops rolling once it's tightly bound and flattens against the vessel wall. The leukocyte crosses the vessel wall by extending its pseudopods through the gaps, pulling themselves through and into the extravascular space. This process is known as diapedesis. Once in the extravascular space, the leukocyte begins to migrate to the site of injury by following a chemical gradient. A common signaling chemical is C5A of the complement system. Concentrations of C5A are highest where the tissue is injured. This process of following increasing chemical concentrations to the injury is called chemotaxis. Once the leukocyte arrives at the site of injury, it goes into action to clear and prevent infection by releasing cytokines or phagocytosing material. Neutrophils, the main leukocyte present in acute inflammation, primarily acts through phagocytosis. These vascular and cellular changes combine to result in the clinical signs of inflammation.
Now, immigration and diapedesis. The marginated neutrophils are immigrated in a large number from the blood at the site of the infection that are caused by the foreign microorganism. Now they are motile and move by the process of diapedesis into the tissue by passing through the junction between the endothelial cells of blood vessels. Diapedesis of the neutrophil is brought about by microtubules, microfilaments and interaction of actin and myosin on the inner side of the cell membrane. Then what is chemotaxis? Chemotaxis refers to the process by which the neutrophils are attracted towards at the site of inflammation. And the process of the chemotaxis is mediated by the chemotactic agent that is known as chemokines, which are released at the site of infection. So these are a chemotactic source and these are the chemotactic substances. So neutrophils are attracted towards the site of infection. There are various types of the chemokines and they include leukotriene B4 and components of the complement system and cytokines like polypeptides from the lymphocyte and monocytes. The chemoattractants increase the adhesive nature of the neutrophils which form the clumps surrounding the infected area. Now, further stages are opsonization. Opsonization refers to the process of coating of bacteria by opsonins. So this one is bacteria. Okay. So opsonization means the process of coating of bacteria by opsonins by which the bacteria become testy to phagocytes. The principal opsonins are naturally acting factors in the serum and include immunoglobulin G opsonin and opsonin fragment of complement protein. So these are the bacteria and there is a coating of bacteria so that the bacteria become tasty to phagocytes. So opsonized bacteria are easily bound to the surface of phagocyte and this process triggers the G protein mediated responses, increases the motor activity of the cell, exocytosis and respiratory burst. Now what is the respiratory burst? So respiratory burst is a rapid increase in the oxygen consumption during the process of phagocytosis by neutrophils and other phagocytic cells. Nicotinamide adenine dinucleotide phosphate oxidase is responsible for this phenomena. During the respiratory burst, the free radical is formed and two molecules of the free radicals combines with the two atoms of hydrogen to form hydrogen peroxide. Now both free radical and hydrogen peroxides are oxidants and having a potent bactericidal action. Then engulfment stage. The increased motor activity of neutrophil that leads to prompt ingestion of bacteria by endocytosis. The neutrophil that project pseudopodia around in opsonized particle which bound to the surface of neutrophil. So neutrophil that project pseudopodia in all the direction around this opsonized bacteria and which is bound to the surface of neutrophil. Now this pseudopodia that meet each other on opposite side and fuse. Now that creates a enclosed chamber with engulfed material. Then it breaks away from the cell membrane forming a phagocytic vesicle. Then the lysosomes of the cell that fuse with the phagocytic vesicles to form a phagolysosome or phagosome. Then the stage of degranulation. Once the bacteria are engulfed, the lysosomes pour their enzymes into the vesicles and also in the interstitial space. This process is known as degranulation, and there are a large number of the proteolytic enzymes specially geared up for digesting the bacteria. In addition, the lysosomes of the macrophages also contain lipase which can digest thick lipid membranes possessed by certain bacteria. So these are the degranulation stage. Then killing or degradation stage. The neutrophil and macrophages contain bactericidal agents like defensins alpha and beta which can kill most of the bacteria even when the lysosomal enzymes fail to digest them. And the bactericidal substances that accomplishes the killing process by the mechanism like oxygen dependent bactericidal mechanism, so which is mediated by oxidizing agents superoxide and H2O etc. formed by the membrane bound enzyme NADPH oxidase which leads to sharp increase in oxygen intake, and free radicals that is generated by the reaction. So free radical that is formed by the addition of the one electron to oxygen. Now two free radicals react with the two hydrogen ions to form hydrogen peroxide, and this reaction is catalyzed by the enzyme superoxide dimutase present in the cytoplasm. Now free radical and hydrogen peroxides both are bactericidal agents, but it is converted by the enzyme catalase into water, H2O and O2. Neutrophil also discharge another enzymes known as myeloperoxidase which converts these ions into their corresponding acids, and these acids are also potent oxidants. Then oxygen independent bactericidal mechanism that works through lysosomal hydrolases, defensins and cationic proteins, elastase and metalloproteinases that attacks directly to collagen and other proteinases destroy the membrane of the invading bacteria. Now in congenital myeloperoxidase deficiency, there is a reduction of the microbial killing power of neutrophils due to non-formation of the hypochlorous acid. Now there are certain important notes about the neutrophil. So phagocytosis that is completed after the stage of the killing is over, and neutrophil can usually phagocytose 5 to 20 bacteria before it itself becomes inactivated or dead, and neutrophils are not capable of phagocytosing particles much larger than the bacteria. Then neutrophils killed by the toxins released from the bacteria are collected in the center of the infected area, and these are known as pus cells, and together with the plasma leaked from the blood vessels, liquefied tissue cells and red blood cells escape from the damaged capillary that all together that constitute the pus. Then what are the variation in the counts? So first of all, neutrophilia. Neutrophilia refers to increase in the circulating neutrophil count, absolute count that is greater than 10,000 per mm cube, and it is the commonest cause of leukocytosis. So what are the physiological causes of neutrophilia? So first of all, in newborn baby, after meal, after exercise, pregnancy, menstruation, parturition, lactation, mental stress and emotional stress, and after the injection of epinephrine. So in all these conditions, there are a increase in number of neutrophilia more than 10,000 per mm cube. Then there are a certain pathological condition in which the neutrophil counts are increased, like acute pyogenic bacterial infections, non-infective inflammatory condition like gout and acute rheumatic fever, acute tissue destruction as in burns postoperatively, and myocardial infarction. Then in acute hemorrhage, myeloproliferative disorders like the polycythemia vera, and poisoning by chemicals and drugs like lead and mercury, then poisoning by insect venom, and intoxicating conditions like the uremia and diabetic ketoacidosis. Then what are the causes of neutropenia? Typhoid and paratyphoid fever, malaria, aplasia of the bone marrow, and bone marrow depression due to drugs such as chlormyocetin and cytotoxic drugs used in malignant disease, and repeated exposure to X-rays and radiation and chemical poisons like arsenic. Then comes to the next cell, eosinophil. What are the functions of eosinophil? So it has a mild phagocytic phagocytosis. So eosinophils are not very motile, and thus they have a very mild phagocytic activity. Eosinophils, like neutrophils, they are attracted towards the endothelial cells by selectins and enter the tissue by diapedesis. Then role in parasitic infestations that play a very important role in the defense mechanism of the body, especially in parasitic infestations. And eosinophils act through the lethal substances that are present in their granules. So in the granules there are a substances present. First of all is major basic protein that makes about 50% of the mass of the large granules, and it is a highly larvicidal polypeptide. Because of this, the eosinophils are able to damage the parasitic larva, and which are large to be engulfed by the phagocytosis. Then eosinophil cationic protein, that is potent bactericidal and major destroyer of the helminths, and it is about 10 times more potent than the major basic protein in destroying helminths by the means of complete disintegration, and it is also a neurotoxin. Then eosinophil peroxidase, that is capable of destroying helminths, bacteria and tumor cells, and eosinophil derived neurotoxin is capable of destroying the nerve fibers. Then role in allergic reaction. The eosinophils increase in the number in allergic condition like the bronchial asthma and hay fever. They are capable of detoxifying the inflammation inducing substances that are released by mast cells and basophils, and that substances are like histamine and bradykinin. They inhibit the mast cell degranulation, and they phagocytose and destroy the antigen antibody complexes, and so that prevent the spread of the local inflammatory process. Now aryl sulfatase B, that are present in the fine granules of the eosinophils, and that has an ability to inactivating the sulfur containing leukotrienes that tissue mast cells liberate in immediate hypersensitivity reaction. Then lysophospholipase. It, it is an unusual membrane-bound protein present in the eosinophil, which forms a crystal called charcot-laden crystals in the pulmonary secretion of the patient with bronchial asthma. Then role in immunity. The eosinophils are present in abundance in the mucosa of the respiratory tract, GI tract, urinary tract, where they probably provide the mucosal immunity. Then eosinophilia. Eosinophilia refers to increase in eosinophil count more than 500 per mm cube. Then what are the causes of eosinophilia? So allergic condition like the bronchial asthma and hay fever, then tropical pulmonary eosinophilia, then parasitic infestation like intestinal worms like hookworm, roundworm and tapeworm, and skin disease like urticarial and scarlet fever. Then eosinopenia means decrease in the eosinophil count less than 50 per mm cube. Then eosinopenia occurs in on patients is on adrenocorticotropic hormone and steroid therapy, then stressful condition and acute pyogenic infections. Then functions of basophils. So basophils have also a very mild phagocytic function. Then it has also a role in allergic reaction. So basophil enter into the tissue and release the cytokine and inflammatory mediators such as histamine, bradykinin and slow reacting substances of anaphylaxis and serotonin. These substances in turn cause the local vascular and tissue reactions and that cause allergic manifestations by binding of specific antigen to cell-fixed immunoglobulin E molecules. Then it has also role in preventing the spread of allergic inflammatory process. Basophil also release the eosinophil chemotactic factor and that causes eosinophils to migrate towards the allergic tissue. And eosinophils then phagocytose and destroy the antigen antibody complexes and prevent the spread of the local inflammatory process. Then release of heparin. Basophil release the heparin in the blood which prevents the clotting of the blood and activates the enzyme lipoprotein lipase which removes the fat particles from the blood after a fatty meal. Then basophilia. Basophilia refers to increase in the basophil count more than 100 mm per cube and causes of basophilia are viral infection like influenza, smallpox and chickenpox and allergic disease and chronic myeloid leukemia. Then decrease in basophil count is known as basopenia and basopenia that are seen in corticosteroid therapy, drug-induced reaction and acute pyogenic infection. Now mast cell. Mast cells are the large tissue cells resembling basophils and they are present in the bone marrow and immediately outside the capillaries in the skin. And these are the granulated cells of connective tissue and their granules contain proteoglycans, histamine and many proteases. Then what are the functions of the mast cells? So mast cells that plays a very important role in allergic reactions similar to basophils. When the allergens that bind to the surface of the mast cells coated with the immunoglobulin G molecules, the degranulation of the mast cells occurs and so that they are involved in inflammatory responses. That also play a very important role in acquired immunity. They release tumor necrosis factor alpha in response to bacterial product by antibody independent mechanism. Then what are the functions of lymphocytes? Lymphocytes that plays a very important role in immunity. And what is the immunity? Immunity is the capacity of the human body to resist all the types of the microorganisms and toxins that tend to damage the tissue or organ. Functionally, the lymphocytes are divided into two types, B lymphocytes and T lymphocytes. So what are the functions of B lymphocytes? So B lymphocytes as well as their derivatives, plasma cell. Both are responsible for the development of the humoral immunity and also called antibody mediated immunity. B lymphocytes that produce antibodies means gamma globulins which circulate into the blood and that constitute the humoral immunity. Now humoral immunity, it is the major mechanism of the defense against the invading organisms, especially the bacteria. Now antibody fight against the invading organism by direct action by making them inactive by agglutination, precipitation, neutralization or lysis and also through the complement system. Then functions of T lymphocyte. T lymphocytes are responsible for the development of the cellular immunity, also known as cell mediated immunity or T cell immunity. And cell mediated immunity plays an important defensive role against the viral infection, some bacterial infection and against the tumor cells. And T lymphocytes are also associated with the two main functions in immune mechanism like cellular immune reaction and hypersensitivity reaction. Cellular immune reaction are mediated by T lymphocytes such as cytotoxic or killer T cells and CD8 T cells. Hypersensitivity reaction mediated by CD4 T cells. Then immunoregulatory function. So CD4 helper cells regulate the immune mechanism by regulating the functions of other T cells, B cells and hematopoietic stem cell. Then lymphocytosis means increase in the lymphocyte count more than 4000 per mm cube. Then there are a certain physiological condition in which the lymphocytes count increase. So first of all, in healthy infants and young children, the lymphocyte count is usually high, while the total leukocyte count is normal. In females during the menstruation, lymphocytes are increased. Then there are a certain pathological condition in which the lymphocytes count are increased, like chronic infection for tuberculosis, hepatitis and whooping cough. Then viral infection like chickenpox and autoimmune disease like thyrotoxicosis, infectious mononucleosis and lymphatic leukemia. Then lymphopenia means decrease in lymphocyte count less than 1500 per mm cube. Then what are the causes of lymphopenia? So patients on corticosteroid and immunosuppressive therapy, hypoplastic bone marrow, widespread irradiation and acquired immunodeficiency syndrome. Then monocyte. So what are the functions of monocytes? So its first main function is role in defense mechanism. Monocytes along with the neutrophil play an important role in body's defense mechanism, and their main function is phagocytosis. Monocytes after entering into the tissue get converted into macrophages, and these are a more powerful phagocytes than neutrophil and are capable of phagocytosing as many as 100 bacteria, and they also have the ability to engulf the large particles such as red blood cells and malarial parasites. And the process of the phagocytosis by monocyte is similar to that described in neutrophils. Then precursor of tissue macrophages. Monocytes are the precursor of tissue macrophages, and the mature monocytes stay in the blood only for few 10 to 20 hours. Then they leave the blood to enter the extravascular tissue and get converted into tissue macrophages. Then role in tumor immunity. So monocytes may also kill the tumor cells after sensitization by lymphocytes. Then synthesis of biological substances. So monocytes synthesize the complement and other biologically important substances. Then monocytosis. What is the monocytosis? Means increase in the number of monocytes above 800 per mm cube. That is known as monocytosis. Then what are the causes of monocytosis? So certain bacterial infections such as tuberculosis, syphilis and subacute bacterial endocarditis and infectious mononucleosis, in which condition the monocytes count are increased. Then also in viral infection, protozoal and rickettsial infection like malaria and Kala-Azar. Then hemopoietic disorders like monocytic leukemia and myeloproliferative disorders and collagen vascular disorders. Then monocytopenia. Monocytopenia refers to decrease in the monocyte count. Then what are the causes of monocytopenia? It may be seen in hypoplastic bone marrow. Thank you very much.